Hello, could you please introduce yourself and your position in this organization?
Hi, my name's Achyuta Koravatikanti. I'm a second year neuroscience major, and as a part of my club, the International Collegiate Health Initiative, I'm currently the executive assistant.
Okay, what does your organization do?
So, our organization is primarily focused to increase health outcomes for people in the LA community as well as globally. And that's just straight up shown by the fact that our organization is called International Collegiate Health Initiative. We're a group of undergraduates, grad students, and UCLA alums who work to increase health outcomes by using networking skills and using our capabilities undergraduates to form connections um, to help these people who are suffering from some sort of health disparities as a result of as a result of factors that they cannot control.
Mhm. So what does being a member typically look like?
So, as far as weekly time commitments, which is what I think this question is maybe geared towards, it's around 2 hours per week in like face-to-face or like Zoom meetings, and outside of that, 2 hours per week, there's around 4 to 6 hours, I would say, of individual time commitment, like completing your tasks and working to working to better the organization outside of that, and then it repeats every week throughout the quarter, and we also do work over the summer in like a little bit less structured of a fashion. I'd say over the summer, the time commitments may be a little bit lower, but it's still definitely there.
Okay, what makes your organization different from the other pre-health organizations on campus?
Yeah, so one thing about ICHI is that I refer to it as a club, but in reality, it's actually a 501(c)(3) nonprofit organization. It just happens to be based in UCLA and run by UCLA students. And this nonprofit status for our organization lends us to have a lot of possibilities for funding, not just within UCLA, but also outside of UCLA. And we also tend to benefit from the ability to create better connections with people outside of UCLA. For example, we're actually partnered with the local government in the cities of Maywood and Bell, which are cities in East LA. And we get governmental support to run events that we host, like various health fairs, and just for our overall projects that aim to improve health outcomes in those areas and globally.
Okay, is there an application for your organization? And if so, what are they do? And what does the application process look like?
Sure. So our application, from what I remember last year, it opened before school started, maybe like 0 week or maybe even before 0 week, and it closed around like week 2 or week 3. And interviews were like just shortly a couple days after that, and decisions were released maybe like less than a week after the interview. So by the middle of fall quarter, you would find out whether or not you're going to be a part of our team.
Okay, great. What qualities distinguish applicants as strong candidates for your organization?
So I'd say a strong understanding of your capabilities as an individual, as a college student. I think a lot of undergraduates at UCLA and like honestly on the national level feel that their best way to contribute towards health outcomes is by engaging themselves in medical related things. But there's another side of our skill set as undergraduates, which is communication and working towards allowing institutions and other organizations that are better equipped at serving people to actually serve those people. So we would definitely look for a strong sense of individual capabilities. And on top of that, just an overall sense of determination. A lot of the tasks that we do as a part of ICHI are not structured per se. They do have a goal and there is an outcome that we hope to achieve, but the means by which we get towards that is um, it's not standard. It's very out of the box, you can say, in ways. It really requires a huge deal of individual commitment and like dedication to a certain project in order to reach that outcome. So creativity, dedication, and also just overall understanding of yourself.
Mhm. And what is one impactful personal experience you've had within the organization?
Sure. So last year I was actually an operations officer, and as an operations officer, I mean I rotated through the committees, ensured that they were working efficiently, and like overall gave reports back to our CEO, work towards delegating tasks and just maintaining efficiency. And as a part of this role as operations officer, I had a side project which was called the Continuity of Care Project. And basically, this project was aimed to establish a continuity of care for patients in the Los Angeles area who can receive like care in the form of a health fair, but afterwards there's no established like form for them to receive further care. And so, as a part of this project, I was tasked with communicating with local hospitals in the Maywood and Bell area, and like honestly, just the greater East Los Angeles area, communicating with those hospitals and clinics, and seeing if they can set up some sort of program that can establish a continuity of care for our patients. And so, as a part of this project, I maybe communicated with like dozens of hospitals and clinics, and over the year-long span of this project, I talked to many people, and I actually established a couple partnerships so that our hundreds of patients that see us at health fairs are now able to receive continuity of care. And I thought that was really impactful because even though that role was not hands-on specifically, I was really quickly able to understand the impact of that just by numbers and how just by numbers and also the impact that those pre-existing organizations do have on the patients that go there. So I do know that the patients that I saw at our health fairs are going to have greater access to care, and it's played in part because of the efforts that I took. So I think that was really impactful. It's a direct result of my efforts, which I think is just really meaningful in an overall like in honestly any environment.
Yeah, thanks for sharing that. How does your organization give back and impact the community on a larger scale?
Yeah, so other than I guess through projects like what I mentioned, the continuity of care
Mhm.
projects, we do have quarterly health fairs that we run either in Maywood or Bell, which are like the two cities we're primarily based in, I would say. And that's not the limit, like our operations suggest there. We also happen to have a chapter in EMU, I believe it stands for Eastern Mediterranean University in Cyprus. But anyways, we have these quarterly health fairs, and we have various medical services that we offer at these health fairs. We actually get a couple doctors that come in from various hospitals that volunteer their time and work to like check on these patients, give them a quick checkup, and then recommend them for any sort of further care. And so we give back through these methods. We also, through our various committees, have other opportunities to give back to our community through various marketing opportunities that advertise things that can benefit your health. And these can include various things that we've established in the past, like, for example, a prescription medication assistance program that we have, which is basically a free prescription refill for patients who are unable to access those services or access those services or afford those services to refill their medication. Telehealth services, just honestly a wide range of services that aim to increase healthcare reach for patients that otherwise don't have that access. And that's the motto we really stand by at ICHI.
Yeah. And lastly, is there anything else you wanted to share about your organization that you didn't get a chance to?
So I kind of want to slightly go back to the question you asked me about what makes our organization unique. So
Mm.
on top of the fact that we're a 501(c)(3) nonprofit, I would say just the fact that there's so much effort that's spurred individually that really develops some independent skills in our members. We really we work towards our own goals and we do whatever is possible to get to that outcome. And there's not a huge there's not a ton of supervision in that case. There's a lot of the effort is kind of put a lot of the responsibilities put on you, and as a result of that, you really develop skills in like how to reach the outcomes that you need to get to. And that's in contrast to I would say other clubs maybe where there's a constant there's kind of like a hand holding in the tasks that you complete. I would say the autonomy that ICHI really provides you as a member to complete your tasks is really unparalleled, and that independent aspect of ICHI is honestly what leads us to really great
Mhm.
results.
Yeah, and thank you so much, ICHI and Atruta, for speaking with us today.
Yeah, thank you, Darlene, for the opportunity.
Yeah, you're welcome.